Okay, and when you first got to the Carrollwood residence and observed this person, you described him as being very pale, correct?
Correct.
Underweight?
Yes.
Okay. And I believe you previously testified he was so thin that you were able to see his ribs. Is that correct?
That's correct.
Okay. Did this person look real sick to you?
He looked like he had a chronic health problem.
Okay. And is it fair to say that he had the physical characteristics of someone who had been a drug addict for a long time?
That's a hard statement. There's people who have chronic illnesses can look like a lot of things. I've seen drug addicts that were overweight. I've seen drug addicts that were underweight. So I just recognized what I thought appeared to be a chronic illness.
Okay. And when you first arrived to Carrollwood, were the gates, the front gates of the property already open?
Yes, they were in the process of opening. Drove up.
Okay. So you drove up onto the property at that point?
That's correct.
Okay. And who were you greeted by first?
Security.
Okay. And then the security then allow you into the residence?
That's correct.
Okay. And then security then escorted you upstairs to where Mr. Jackson was, correct?
That's correct.
Okay. And do you recall whether the door to the bedroom where Mr. Jackson was that open?
Yes, it was.
Okay. And what was the first thing that you saw?
Dr. Murray standing beside the bed and leaning over the patient. The security guard also leaning over the patient, and the patient himself in bed.
Okay.
Well,
okay, and I believe you testified that when you first walked in that Mr. Jackson was still on the bed, correct?
he was actually being moved, so his upper torso was still on the bed, his feet were on the floor, and they were in the process of moving him.
Okay. Can I have one moment, Your Honor?
Sure.
Mr. Senneff, showing you what's previously been marked as People's Exhibit 23. Can you show us where exactly Mr. Jackson was?
Yes, his head would have been right here. His body was at an angle, so this margin of the mattress would have been across the middle of his back, and the feet were being lowered to the floor here. Okay,
so his upper body was still on the bed, correct?
Correct.
Okay. And what time did you arrive at the Carrollwood residence?
12:26, I believe.
Okay, and what time did you arrive upstairs by Mr. Jackson?
Less than a minute.
Okay, so approximately 12:27?
Yes.
Okay, so at 12:27, when you first entered the bedroom, Mr. Jackson was still, part of his body was still on the bed, correct?
Correct.
Okay, and did you notice any type of IV tubing on Mr. Jackson at that time?
Yes, I did.
Okay, and can you tell us what you saw?
There was IV tubing connected to his left calf.
Okay, and that would have been, again, at approximately 12:27, correct?
Correct.
Okay, so the IV tubing was still in his leg, correct?
Correct.
Okay. Did you see anything else attached to Mr. Jackson at that time?
I did not.
Okay. So soon after, you start asking Dr. Murray some questions, correct?
Correct.
And Dr. Murray, in fact, starts responding to your questions and gives you some information, correct?
Correct.
Okay. Now, Dr. Murray told you that he was Mr. Jackson's personal doctor, correct?
Correct.
Dr. Murray also told you that Mr. Jackson was rehearsing all night, correct?
I didn't hear what he said, the first part. I heard him say 16 hours last night.
Okay. And Dr. Murray also told you that he was treating Michael Jackson for exhaustion, correct?
For exhaustion and dehydration,
Okay.
yes.
So he also told you he was treating Mr. Jackson for exhaustion, correct?
Yes.
Okay. And you asked Dr. Murray whether Mr. Jackson was on any recreational drugs, correct?
I don't remember if I asked that or not. I have. That's a common question I ask. I don't think I did ask that.
Okay. Do you think it's fair that maybe somebody in your team may have asked that?
It's
Sustained. There's a partial answer, Inspector.
Okay. You don't recall asking that question, correct?
correct.
Okay. But Dr. Murray did tell you that he gave Mr. Jackson a sedative to help him sleep, correct?
Correct.
And in fact, he identified that sedative as lorazepam, correct?
Correct.
Okay. And in fact, on the teletype that was shown to you earlier, you in fact had handwritten the word lorazepam, correct?
Correct.
Okay. And are you familiar with lorazepam?
It's not a drug that I'm trained to use. I am familiar with it, but not in detail.
Okay, but it is a drug that, in your system for an extended period of time, correct?
I actually don't know what its half-life is.
Okay. And can you describe the scene for us when you're asking Dr. Murray these questions?
I was the first one up the stairs, so I was probably I probably had a 5-second head start on everybody else. The doctor and the security guard were moving the patient to the floor, and I'm setting down my box and asking a lot of questions. And firefighter Heron is right behind me, and we moved the patient to the foot of the bed.
Okay, so there was a lot of confusion during this time, correct?
There was a lot going on.
Okay, and it's fair to say that Dr. Murray was busy and he was multitasking at that time?
Yes.
Okay, and in fact, at the preliminary hearing, when you were asked, what you thought of Conrad Murray not responding to a particular question or not responding right away, you said it's because you thought he was busy, correct?
I don't actually remember what I said specifically, but he was very busy.
Okay. So at some point, you then moved Mr. Jackson to the foot of the bed, correct?
That's correct.
And that's to give you and your team more room to work?
That's correct.
Okay, and to do that, you actually needed the help of another firefighter, correct?
That's correct.
And that was firefighter Heron?
Heron, yes.
Okay. And I believe you described firefighter Heron as a big, strong fireman, correct?
Strong as an ox.
Okay. So it took both of you to move Mr. Jackson to the foot of the bed, correct?
That's correct.
Okay. Soon after, you start performing CPR, correct?
Correct.
All right. And who was in charge of the compressions?
Firefighter Heron was doing compressions.
Okay. And who was in charge of providing air to Mr. Jackson?
Firefighter Blunt.
Okay. So there was 2 paramedics performing CPR on Mr. Jackson, correct?
No, that's not correct.
So paramedics were responsible in administering CPR to Mr. Jackson.
Firefighter EMT Heron was doing the CPR. We also had Fire Captain Mills was on scene. I don't think he was doing CPR. Firefighter Blunt was ventilating and getting his intubation set up. Paramedic Goodwin was setting up the EKG cables, and as I said, I was gathering information.
Okay, so Mr. Blount was in charge of the ventilation.
Yes.
Okay, and Mr. Heron was in charge of compressions, correct?
Yes.
Okay, so there's essentially 2 people at that point in time working on Mr. Jackson as far as ventilation and compressions go.
Correct.
Okay, and that's not unusual, is it?
No.
Okay, so if you were to hear facts that Dr. Murray asked for assistance during CPR, that wouldn't be unusual, correct?
No, it would
In
not.
fact, that would be encouraged, isn't that correct?
Yes, you wouldn't want to do it alone.
Okay, and you're familiar with the American Heart Association guidelines on CPR, correct?
Correct.
Okay, and the guidelines also provide that people should work collaboratively when they're performing CPR, correct?
Correct.
Okay.
Let me know, Mr. Gorgian, when it's a convenient time to take the noon break, please.
And that was fine, Your Honor.
May I see counsel first, please?